Welcome and good morning to everybody that's here already. This is our session 2 for our PASRR portal training live demo for nursing facilities and hospitals. The webinar actually starts at 10 a.m. So we'll just give everybody a few minutes to get joined here, a couple minutes after the hour, and then we'll get started. Thank you. All right, once again, good morning for everybody that's joined. We're at about 23 attendees. Welcome to the PASRR portal training live demo round 2. Our first session was Wednesday. We'll give just another minute here and then we will get started. We will be off camera and I'll have everybody muted while we go through our demo. And after the demo is completed, I will unmute the participants and we can ask questions for a open round Q&A. In the meanwhile, I'll ask that everybody use the Q&A functionality or the chat to ask any questions during the demo, and we will be moderating that and answering questions as we go if we can. My name is Amy. I'm the IT project manager for this project. And we'll just go ahead and get started, and I'll introduce to you Joni.
Good morning. My name is Joni Masson, and I am the PASRR coordinator for Access. Well, we are in the process of developing a web portal for a pre-admission screening and resident review program. The web portal will provide a streamlined approach to allow providers and external stakeholders the ability to submit Level 1 screenings and Level 2 evaluation requests, review Level 2 evaluation results, upload forms such as patient records and other required documentation, check the status of PASRRs, verify previous Level 2 evaluations, submit invoices, and query the PASRR database. So currently, Access has a manual submittal and review process via the PASRR email inbox, requiring the PASRR coordinators and external providers to engage in an email exchange, a PASRR level 1s and level 2s. So this portal will allow the providers and external stakeholders to process the level 1s electronically. So I will go ahead and hand this over to Sana. Thank you.
Thanks, Joni. I'm Sana, and I'll be covering the demo portion for this call. So we'll take a look at a couple of things from the perspective of the nursing facility and hospital provider. So just to give a broad view or what the demo is going to show, we're going to see how a user will be able to come into the new Access Solution Center portal and be able to register themselves and create an account, how they'll be able to navigate through the Access Solution Center, how they'll be creating a PASRR level 1 request, which was previously done through the paper PDF form, and how they'll be able to track those requests that are in their queue. So let me go ahead and share my screen. Um, okay, so starting with the first piece, whenever you come in and the first thing that you'll see is the landing page of the Access Solution Center. So if this is the first time you're seeing this page, the number one step would be to go ahead and create an account. So just walking through that, from this page, we can click on create an account. As a nursing facility hospital, we'll be creating the account as a provider. So I'll click on that and kind of just follow the account creation wizard that's on the portal. So I'm creating my account as a provider. I represent the provider on here. And my employer is already registered with Access. So I'll answer yes, and I'll move to the next part. The first thing it's going to ask me is the employer's Access provider ID and tax ID. So these are details that we'll already have based on the employer that you're registered with. So I'll go ahead and enter the data on here, the Access ID, the tax ID, and then I can go ahead and fill some details regarding my account creation. So I'll create an account for Sue over here, provide my email, add my phone number, my address, agree to the policies, and go ahead with my account creation. Awesome. So it looks like my account has been created, and the system has sent me an email. So since this is a test environment and it's not actually sending emails right now, I'll just go ahead and show what that email looks like. Just bear with me. So here the system has sent an email to Sue. We'll see what that looks like. Yeah, it's provided us the user ID and password. I would always encourage saving this at least till the time the system prompts you to save the password, because it's going to ask for the sample password that it's provided. So I'm just going to keep a copy of it on here on my notepad, and then I can go ahead and try to sign into my account. So once I'm back at the Access Solution Center, I'm going to log in. I'll provide my user ID and the password. Yeah, once I try to log in, for security purposes, the system will require me to update my password. So I'm going to provide the current password and pick a new password. Submit. Once I have done that, I will have to use the Authenticator app on my phone. So this is a prerequisite to the process of having the Authenticator app already downloaded. So you're able to scan this code. So I'm just going to do that from my phone. And once I have done that, the Authenticator app will provide me with a code, which I can add on here, pair my device, and log in. Awesome. So now I have created an account. I'm in the system. I can go and see my profile that has just been created. And with this, I'll also get access to a couple of more items on here. I can see the PASRR L1 request when I go to the services tile on this, and I can start creating my PASRR level ones. So I'll just take a quick pause here to see if Bethany, Amy, Joni, you want to add anything while I also get set up for the next part, which is going to be creating the PASRR L1.
Just wanted to quickly ask if there was any questions around the provider ID. I know that came up in our first session, and there is one question by Rita Greenwald. Any questions around the provider ID for anybody here? 1 second. Let me unmute you. Just 1 second. Okay, mics are unmuted. Any questions around provider ID? Okay, if there's no questions around provider ID, then I don't think we need to go through our crosswalk unless questions come up later, Sana. But perhaps as a takeaway there in the Q&A, there is a question around the system generated email. I did answer Rita that the concern was around when the email comes for their password and things like that. Where will that come from? And I said it is system generated, right? So they want to make sure that that can get through their spam filter if there's a spam filter. So perhaps we could take that as a takeaway in the Q&A at the end of the session.
Yeah, that's a great question. In fact, it comes from it has a specific system name. I can provide what that, like who that email will come from.
Perfect. Yeah. Thank you so much.
Awesome. I think in that case, we can go ahead and continue with the second part, which is how to create a PASRR level 1 request. So once we are in this services style on the Access Solution Center, we can navigate to the PASRR L1. I'll go ahead and click on this. It takes me to this L1 form. Now, this is the same form that used to be the PDF, but just in digital version. We have these check boxes here, and this is just to make the form a little more navigatable since it is quite a long form. It breaks it up into like bite-sized sections. So for example, I can open section A, and once I'm done with it, I can close it and just kind of go navigate through the form one by one, as opposed to it being a very long form that I have to scroll through. So I'll start with the demographic section. Um, start filling out the details on the form. PASRR L1 review type, I'll say pre-admission. First name, I'll say I'm filling the form for Eric. The date is already pre-populated with today's date. For date of birth, I would always encourage choosing, navigating to the calendar picker, since the system's a little bit picky when it comes to typing in this date. So I'll go back and pick a date. I have to scroll all the way back since I'm a 90s child. Okay. Marital state, I'll say married, gender, female, current living situation, I'll say nursing facility. In case my none of these options are correct, I can always select other. And when I do select other, it will prompt me to specify which to type in specifically what the living situation is. So I can say something like friend's house. Um, I'll have to provide a phone number. So I can say current living situation, phone type cell. For the phone number fields, the system will require me to add a 10-digit phone number. If I'm not doing that, it'll give me an error message up top and will not allow me to submit as long as I provide a valid phone number. Current living situation address, provide. And at the admission date. One thing to note that at the admission date cannot be in the future. So if I do pick a date that's in the future, I'll get an error which won't allow me to submit the form. So I will have to pick a valid date that would be in the past. So I'll pick a past date using the calendar picker and move on. Current location, again, if I select other, I will be prompted to provide specifically what that is. The access provider ID, this is the same ID that we had used earlier for login. And what this does is when I do provide the provider ID, it will autofill the details that are associated with this provider ID. But in case the information here that it's incorrect, I can always go ahead and update this manually. So let's say the data that's on here is incorrect. I can always update that. Phone number fields, again, I will be required to add a valid 10-digit phone number. If I don't do that, I will be getting an error on here. Payment method, we have three on here, Medicaid, Medicare, and self-pay. If I select Medicaid, I will have to provide a valid access member ID. I'll go ahead and select self-pay. One thing to note is that the form has a lot of mandatory details that the user has to fill. So if I try to submit the form, and right now I have a lot of details in the other sections that are mandatory that are missing, I will be getting that error, and the error will specify exactly what I have not filled out and I need to complete in order to be able to submit the form. So let me go to the next section now, section A, regarding the exemptions and categorical determinations. Starting with, so for section A, based on the answers that I provide on section A, the form will determine whether I need to fill the next couple of sections. And we can see how that works right now. For example, if I can go ahead and say, does the admission meet criteria for 30-day convalescent care? I'll say no. Does the individual meet following criteria for respite admission? I'll say no again. Does the individual meet criteria for severe or terminal illness? I'll say no. Uh, does the individual have primary diagnosis of dementia or Alzheimer's? I'll say no. So now it's saying that I will have to go through section B, C, D, E, and F. But let's say I answer this a little bit differently. No refer is necessary for level 2, skip to section F. So if I say, okay, all these sections will go away and I can directly move on to the attestation. But just for the purposes of this demo, I'll say no, and I'll go through the whole form. Section B regarding mental illness. Again, all these fields in these sections have some logic built into them. So the way I answer this, it'll it may pop in extra fields that I have to provide answers to. So I'll go ahead. Does the individual have any SMI? If I say yes, I will be prompted to answer what those specific um, mental illnesses are. So in this case, I'll say major depression. I can add multiple as well based on the answers. Does the individual have any mental disorders? I'll say yes. I'll be specifically prompted to provide what they are. If I say other, I will have to specifically provide what that other is. Individual have substance related disorder? Yes. Again, if I say yes, I'll be prompted to answer um, specific questions on what that is. When did the most recent substance or less than 7 days? Okay. Moving on to the next part of section B, the symptom section. Has the individual exhibited interpersonal systems or behavior? I'll say yes, and I'll be prompted to select what those specific symptoms were. Concentration task related symptoms, I'll say yes again, and I'll pick what those are. I'll say required assistance with tasks, substantial errors, adaptation to change. I'll say yes to this as well, and I'll pick specifically what they are. Again, if I pick other, I have to provide exactly what those are. Yeah, moving on to the psychiatric treatment section. Currently, within past 2 years, has individual received any following mental health services? I'll say yes, and I'll select what they are. Again, I can pick other on here and type in anything that's needed. For the most recent date, similar to the other dates, I cannot pick a date in the future. I will have to pick a date in the past. I'll go ahead. Currently or within the past 2 years, has the individual experienced life disruptions? I'll say no for this. Has the individual had recent psychiatric behavior evaluation? I'll go ahead and say no. Uh, the next part is the psychotropic medications. So this is where the user will be able to provide documentation. So if we say no, that's it. Nothing else has to be done here. But let's say that there is medications to provide and the user says yes, it'll open this table where they can add any number of medications that need to be added on here. So I'll add some medications by clicking on add. I'll say medication. I'll provide the dosage. And I can also attach a document on here. So I'll need to provide an document and I can add this on here. Likewise, I can provide any number of medication that's on here. Let's say aspirin. Discontinued, no, and I'll have to provide what they are. I can also go ahead and delete any medications on here that I had entered by mistake or I realized I don't take anymore. So that's the medication. We'll move on to the next section, the intellectual disability and developmental disabilities. Again, a couple of questions that are mandatory on here as well that we'll have to answer. Individual have diagnosis of ID. If I say yes, it'll open a couple of other questions for me that I'll have to answer regarding those intellectual disability. Presenting intellect has not been diagnosed. I'll say no for this. Has the individual received services from agency that serves people with ID? I'd say no. Does the individual have a diagnosis which affects intellectual or adaptive functioning? I'll say no. Are there any substantial functional limitations? I'll say no for this as well. The next section, section D, gives me a chance to add some referral documentation that's needed. It has two sections. It's very similar to the medication sections that we just saw. It's divided into two main sections. One part is the mandatory files. So for this, I will have to provide some mandatory files. I will have to at least fill the mandatory file section in order to be able to submit the form. So let me add a document on here. If I have a document that's consolidating all these things on there, I can go ahead and select multiple. Let's say I have one document that has the list of my current medication. At the same time, it also has my history. So I'll add these on here and I'll upload this file. Similarly, I have another document that has the hospital or facility face sheet. So I'll go at that. I will have to provide a document on here because this is mandatory. For optional, I don't have to provide anything on here, but just to kind of give an idea, what I can do here is it's more for, any miscellaneous documents I need to provide. So if I pick other over here, I'll have to specify what this is, and then I can go ahead and add a document that has my medicines. Just to kind of show that this part is optional, I'll go ahead and delete this and leave it blank, and we should still be able to submit this form. Moving on to next section, section E, regarding attestation of individual. I'll go ahead and fill this. The date is pre-populated and I cannot edit it. Let's see the physician's name. Say a valid phone number that cannot be less than 10 digits, and a valid email as well. Excuse me. Provider address. In this case, I'll say I am the individual and I'll get a note over here. I'll go ahead and agree to the attestation that's on here, and I'll write the name of the attester on here. If necessary, any other additional information. In this case, I don't have anything, so I'll just go ahead and leave this field and move on to my next section, which is regarding the attestation of the L1 screening. So I'll provide the name of the screener on here. I'll go ahead and read the attestations on here. Professional title. I'll need to add a valid phone number again. And I'll add the email. Okay. So once I have completed the L1 form, I'm also able to attach a document on this. So I can using the paperclip, but I can also do this after submitting. So I'll show how this works after I've submitted the form. So I think I have gone ahead and completed the entire L1 form. I'll go ahead and click on submit. Okay, perfect. So it's gone ahead and accepted my L1. The case number that it's created for me is 1035, and I can see that the stage is intake. using the print icon on here, I can go ahead and download a PDF version of the form, and this is just for my records. Awesome. So now we are back to the Access Solution Center. When we navigate to the PASSR L1 cases tile from the top right over here, it's going to show all the L1 cases that have been that has been created by me as a user. Currently, I can see that the PASSR L1 case that I've created is in the open state. If I go ahead and open this, it's going to show me the form that I have just submitted. And I think you can notice that all these fields are currently grayed out, which means once I click on submit, I cannot make any changes to the form that I've just submitted. But it's up to the passer agent. If they require any more details, they can go ahead and open this form back up for me to go ahead and make any updates. So I'm just gonna show how that works. Um, I'll have Shri, who's on the call, to help me. So Shri will pose as the passer agent and open this form up for me to make any changes that and this is just to cover any, if there were any mistakes made on the L1 form. This is the way those issues can be resolved. So Shri, if you're on the call, are you able to give me feedback on my L1 and open it back up for me to provide any updates to you?
Yes, I am putting in my comments right now.
Awesome. Okay, so looks like I have some feedback from the passer agent. Please check the answers to section B to see if psychiatric evaluation is indeed needed if the person was hospitalized after a depression diagnosis. That's a good question. So let me go ahead and refresh this form. Okay, awesome. If I go to section B, looks like it is back open for me. And I can also notice if I go back to my passer L1 cases that 1035, which was in the open state, is now in the awaiting info state. So this is the state that differentiates the form from being locked to me to being back open to make any updates. And I can show this, for example, if I go to another old form that's in open state, again, I I cannot make any updates on here, but let me go back to 1035, which is the one that I just created. Based on this, I can make any updates. So let me go to section B, and I think it was the psychiatric evaluation is needed. Let me go ahead and make some changes on this section so I can. I'll say no on here. And I'll add it. Okay. Now I have made some changes. I can go ahead and click on save. and my updates would have gone back to the PASSR agent. So Shri, if one more time you could review how the form looks like right now and update it from the awaiting info state. Okay. Looks like the PASSR agent is happy with the updates I've made, and they have moved the form to work in progress from awaiting info. So I was able to make those updates and they have been captured, and the form is now back to being logged out for me to be able to make any updates. So I think that brings us to the end of the L1 process. I'll pass it back to Amy, Joni, and Bethany to yeah, go ahead and answer any questions or address anything else that we need to cover for this training. But this brings
Thank
us
you,
to the
Sana.
end.
Yeah, thank you, Sana. Very appreciated. So that's the conclusion of the live demo. We have time for Q&A, and also, did you want to provide that information on the system generated email?
Yes, I'm just going to add that on the chat.
Okay, wonderful. I have unmuted everybody. Are there any questions, concerns, feedback?
I have another question. What is the name of the app that is required, and is it required? Like, what if we don't require our staffs to use their personal phones? So is there a workaround if for the authentication?
The app is called Authenticator. I'll pass on to Amy to address the smartphone.
That is a requirement at this time for the authentication. Yes, ma'am. I can definitely look into the question deeper as far as if there's a workaround, but not at this time.
Okay, thank you. That'd be great.
Okay, you're welcome.
Sorry, I have another question. I'm so sorry. I don't need to take up all the time, but for
No,
the
it's okay.
required documents, would it be possible for us to like create a packet that included all the required information and just upload the one document as opposed to having to do them all separately?
Yes, Rita, you can do that. All you'll have to do is when it asks you to that what document this is, you can just add all the options. Say that yeah, this is one document. It contains all these things, and just
Okay.
upload that.
Okay, great. Thank you.
There's one question. Oh, sorry. There's one question in the chat for the business. So you don't have to get a signature for a patient to complete PASRR? Can the business answer that?
If the patient is unable to sign, then you can have the physician or the healthcare medical decision maker sign off on that.
Does that answer your question, Harry?
So it's pretty much the same way as with the paper level 1.
How are they signing though for completing these at our computer?
Signing for the patient or for the person completing the level 1?
The patient or provider?
Yeah, they would. Well, if the patient's there, then they can go ahead and indicate yes, for should it go to process to a level 2, then we would need a signature. If it's not going to be going for a level 2, then no, there wouldn't be a signature.
So we print it and get a signature on the printed form?
Sana, that's a good question. Is it something, because I don't know if you're going to be having like a computer with you bedside or if you're going to be in your office completing all the information. So is there something that they would check off on that computer, Sana, or is it best just to go ahead and have it printed?
I think the overall
This is
question is if going to go to a level 2, where would the patient sign on the level 2, on the level 1 form?
So well, that's a good question. I don't know if they would sign, if they would have to print it out for the signature and then just attach it somewhere and upload it versus having an electronic device where they can go ahead and indicate and sign it.
Yeah, currently either the print out or if there's anything like electronic sign that they have on their computers, they can use that. Yeah.
Okay, I'm going to mark that as a takeaway for further discussion. Thank you, Rita.
Yes, Rita,
Yeah,
thank you.
and then I don't know what we would do with that signed document, if that makes sense.
Well, we are trying to we're trying to move away from paper, printing, scanning, emailing, right? And at some point we'll be disembarking from the whole email exchange. So this is part of this entire project, is to have the automation. So I'm not sure if that's something that just needs some further clarification and or a training user guide. So that's something I'll take away as far as if it's going to be moving to a level 2, where does the patient sign and how does the patient sign? So definitely we'll put that as a takeaway. But yeah, we are definitely moving towards the digital age, right? So we don't want, the whole purpose would not be to have you guys printing off forms and having signatures on paper forms and then having to scan them and attach them back. That is an option, where Sana had showcased anywhere on that form, you can attach a document with the paperclip function, just like you can, in a regular email. You can attach it right to that level 1 form from the portal. So if you did have to print something off and get an actual pen to paper signature, you can print that out and then you can scan it and upload it right to that actual case number, so that you're not having to use that email. But we're trying to streamline that so that we don't have all of our users having that to do that functionality. Does that help?
Yeah, thank you. I appreciate that you'll look at that.
Yeah, so not really sure if that's like a miss there or just a clarification, but we'll definitely take that back. I appreciate that. If that answers your question, that was from Harry. Okay, so then there is, what file is added to the med list area? Joni, do you want to take that?
Okay, so what file is added to, is it on the medication? So usually how, when you submit the level 1, and we're just looking at the psychotropic meds, that you can go ahead and attach or combine all of them. As Sana had mentioned earlier, how you can upload each, or you can go ahead and combine. So you can go ahead and add the medication list to that. So I hope that answered your question.
Yeah, and if the question is regarding like what type of file, it doesn't matter. It can be doc, a doc or a PNG, anything.
Okay.
Medication
Medication list from Cerner. So that's, go ahead.
Yeah, that's dealing with your electronic medication list. So I take it, Chris, you're with the hospital. I guess if you could print out the medication list and then you could use that as an attachment.
I think, yeah, if you're asking in lieu of having to input it on the way that Sana demonstrated it, she's saying you could do that workaround where you would export it from your EMR and then you could upload it. And I apologize if there's a mic issue, but I do have all of the participants unmuted. So I'm not sure if it would be on each individual side that maybe to check your mic settings on your side. I apologize for the technical challenges. Oh, some of your computers don't have mics. Oh, okay. Well, all right. That would make sense. Okay. Sorry about that. So yeah, we can just work through chat. So does that answer the question on medication list? I think it does. You could just give a thumbs up to Chris. Okay. All right. Jill, did you want to go ahead?
Yeah, can you hear me okay?
Yes, ma'am.
Okay, can you speak to the time frame once we complete a PASR, and then we go to your cases, and then if it were to say awaiting info, what is that time frame? Is that like within an hour we're aware of like more documentation that's needed to complete the level 1? Or is it a day?
Jill, if when you submit your level 1 and everything is okay, then it's on my side now. So I have within a day or so, and I hopefully I can get it with this new system. It might be forward over to a level 2, but you will be notified. So if there's anything that I need from you, I will let you know. If
Okay.
not, then it's going to go on my side now as the agent, PASAR, and then I will take it from there.
Okay, so the notification, does that mean we have to constantly check the website? Or is there another way you notify us?
Sana, they should be getting an email notification anytime there's an update to any of their case numbers. Is that correct?
Yeah, that's correct. Shri, can you confirm?
Yes, I think we had that configuration set up.
Yeah, it's just that in the test environment, Amy, I just couldn't show that, but ideally, yes. Yeah.
So when the notification happens, oftentimes our staff will be assigned possibly one day, and then the next day they're not there, so it's assigned to another staff member. Is there a way under our provider ID that all of our staff can see all of the PASRs completed for that provider ID? So that way, if one person's notified the next day, they're not even available. So we have no idea how to check up with the PASR that was completed maybe 3 days ago because that staff member is not available anymore.
Son, I think that goes back to our registration around those provider IDs and linking the parent-child relationship. Can you or Shri speak to that?
Yeah, I think
Um,
right now, yeah, sorry, go ahead, Shri. Yeah.
I would say in that case, like the passer agent can always send an email like from the portal directly to the, if there's a group email or if there is a, point of contact that they can, reach out to or or escalate it or something like that. Yeah, like they can send the email and like, they can they can communicate from there. I
Okay.
hope that answers that question.
So every time that you guys need, it says awaiting information, ideally someone from your side would be emailing a group email to let them know that we're still needing information. And then say it's another staff member going on to the PASAR website, how will they get to they get to the form if someone else created it?
They can be facilitated that access from the, agent's side. So the agent has the, ability, the passer agent has the ability to add, people to the watch list of that thing. So like, yeah, technically, the person who has access to the um, record or is given access to that record will be able to see the records and the updates to it.
Okay, so in addition to your team sending us an email to our group message, you will also find out who's assigned to that patient that day and then give them access to the PASRR so they can edit the document.
No, I don't think that sounds right, Sheree. I think what she's asking is, so if Jill fills out the level 1 form and then Jill's out of the office and then Beth needs to pick up where Jill left off, for whatever reason, how is Beth going to be able to access the form that Jill already submitted? So I think that goes back around to that parent-child relationship that any of the evaluators that, I'm just going to use Banner as an example, any of the evaluators that work for Banner should have a parent-child relationship by that provider ID. So does that mean that all of their evaluators can see all of the PASRR level 1s that are within that provider banner or not? Because that was my understanding. So I think that's what Jill's asking. Jill, am I tracking that correctly?
Yes, absolutely. If there's a way we
Okay.
could see all of our provider ID PASRRs that were completed by all of our staff members, that would be so helpful.
I believe that there will be, we can get back to you on that if we don't have the answer right now, but that relationship, that parent-child relationship should be set up. I just don't know for sure if everybody can see everybody's or like one person, like a master account holder can see everybody's or how that would work and then reassign. But it would not be our agent's responsibility to, track your staff and reassign and do all these reassignments back and forth. So Shri, does that help clarify the question that she's asking?
Yes. I can check that and let you know. Like I may not have an answer right now.
Okay, so I'm
Okay.
writing down this parent-child relationship and then
And where on the website? So say we can see all of our provider ID cases. Is it under your cases? Like where would we go on the website to find all of them?
It would be
yeah,
under, sorry, Amy.
yeah, can you share your screen just so they have a visual context to where that would be back to that your cases listing? That might be helpful.
Yeah, I can do that.
Okay, thank you.
Yeah, it would be under your cases for L1 cases where I can see all the L1 cases right now specifically that are assigned, like these are open by me so I can see them, but yeah.
So we would be able to see everyone's under your cases.
Currently, no, but I think that's something we'll check and get back.
Okay, thank you.
We just need to verify, right? Like if under your cases, your provider ID is linked to, those evaluators, providers ID should be child linked to the parent banner, right? Would then all of the evaluators be able to see all the level 1s or just the level 1s that they opened? And I think what Shri was saying is that if you had an out, if somebody was out unexpectedly, Joni on our side, from the access side, as the agent, would be able to reassign it to somebody else, right? But that would then require an email conversation from that portal. You'd have to email in and say, hey, we need you to switch this. And so that would just delay things. So I think we want to avoid that, is what I was trying to communicate. Does that make sense, Jill?
Yes, it does.
Okay. All right, so I've got that down as a takeaway, your name, the question, and then the feedback. Okay, there's one more for Kayla. Are we, as the hospital, supposed to hold patient from going to a nursing facility until it is approved? Meaning it is approved the level 1 or?
I'll go ahead and take that one. And I believe what she's saying, this is a pre-admission process. So let's just say there was a lot of behavioral issues with this person. So this is a pre-admission. So they need to be determined prior to going to a nursing facility. So when it comes to once you fill out the level 1 and there's indicators there that yes, there's issues going on, that's going to be referred to a level 2. The psychiatrist has 3 days to go to the hospital to do a determination whether or not they're appropriate to go to a nursing facility. Number 2, it could be that maybe the physician or the person doing the level 1, well, really the physician, is saying, okay, yes, they do need to go to a SNF. However, they're only going to be there less than 30 days. And if they meet that requirement, then yes, they can submit it to the nursing facility, and the nursing facility will then go ahead and accept the patient. And if the patient is at the nursing facility past the 30 days, so the nursing home should be looking probably at day 25, whether or not they're still going to be there, then they'll come and submit they'll submit the level 1 to me. So if it's a convalescent care, or if there's any indicators that a level 2 is not needed, then no, you're not going to hold it. But if there are issues, because it is a pre-admission, they need to be looked at prior to going to a nursing facility, then we'll send it to a level 2. The psychiatrist has 3 business days to go to your facility to evaluate that patient. So I hope that answers your question.
Kayla, does that answer the question? We'll wait and chat to see, maybe Kayla doesn't have a mic. So then there's another question coming in from Carrie. Are these only for behavioral health patients for the electronic pre-admission?
Yes, and this is prior to admission, and this is to determine if they have or they are suspected of having a mental illness, an intellectual disability, or related condition.
So there's still some confusion around the question from Kayla, the previous question, but so we are going to be working to get a What is PASRR training video posted to the Access PASRR website. Is that currently consumable externally yet, Joni, anywhere else, or are we waiting for that yet to get posted to our PASRR website?
We're waiting for that to be posted to our website.
Okay. So we are asking that everybody in these sessions, so that we have continuity, that you be tracking the PASRR website. I could put it in the chat here for everybody. This is where you're going to get the bulk of your information. All of the user guides are going to be listed. These training videos will be posted and listed. Currently, it's where you were able to sign up for the training session today, updates as to when the go live will actually be launching. And as I said, all of the user guides, as well as we are working, we have a request to get that What is PASRR training posted to this website. And so that'll be coming, I believe, no later than November 8th. So please keep checking back for those communications. I'm going to put that in the chat right now. Okay, I just posted that to the chat. So go ahead and see if you can navigate to that page. And then I would suggest bookmarking that. And that's really where you're going to go to get all of the answers that are PASRR related for you and your staff and your facility. Okay, we've got two more. What is the time frame that the PASRR is approved or resolved?
That would depend. If it had to go for a level 2, if it's for a hospital, it'll be 3 days. If it's for a nursing facility, it'll be 5 days.
Okay, and then if the patient is going to be at a SNF 30 days or less, we don't need to wait for the review of the PASRR, question mark?
Correct, Kristen, and I believe you're in the hospital. So if you guys are saying that they're going to need a SNF level of care for less than 30 days, then no, then the nursing facility is going to accept that patient, saying it's less than 30 days. So then no, you don't need to wait for a review, because there's no referral needed for level 2 if it falls under the convalescent care or respite and that type of situation that does not need a referral, or dementia.
Yes, yes, I did, which means.
You have a birthday on Monday, so you don't want no birthday?
Okay,
For both. It's
we've
a
got
weekend.
You
some
know both of them.
back talk.
I'll send
You
you.
guys are
I'll
unmuted.
send you.
You guys are all unmuted, so unless you want me to mute everyone, then could you mute your microphone if you're talking offline? Thank you. There's another question. If this is completed at the hospital, can the facility receiving the patient see these? If this is completed in the hospital setting, can I'm guessing the skilled nursing facility receiving the patient see these, the level ones forms? Rita?
Sorry, it's probably easier if I just unmute. Yeah, the level one, like, will they be able to see that it's been completed, or that if we're in process with a level 2 review?
I mean, I'm gonna assume maybe the other team can help me with this. I'm gonna assume no, because the
Yeah.
hospital has completed the level 1. So the
Mhm.
nursing facility is not gonna have access to the hospital's level 1s. So there's not a crossover between providers, right? So like
Right.
as a hospital, you have to log in and have your own vetted, authenticated account. As a nursing facility, you have to have your own authenticated user account. As a REBA, you have to have your own authenticated user account. So there's not going to be crossover, so no. I guess the question to that would be
Yeah.
no, and Joni's agreeing with me, correct?
Correct. Yes. So Rita, if you were in the hospital, you would just go ahead and print it out. So when you transfer the documentation to the nursing facility, you would attach that level 1.
So that print functionality that she showed you, where you can turn that, you click that little printer icon and it turns it into a PDF, then you'd be able to print that out and then send it along with the patient, sounds like. Okay, yes, thank you, Chris, for the write out of the acronym skilled nursing facility. Okay, so then in the chat, Bethany has posted some federal guidelines for PASRR. Yes, level 1. Okay, now another one for the nursing facility. Do we have to submit another pre-admission level 1 upon admission?
Dorian, it depends on what the hospital has sent you. So if it needed for level 2, then they should go ahead and forward the level 2 evaluation to you. So for the pre-admission, so no, you would not need to do another level 1 because the level 1 was already initiated at the hospital. The patient was reviewed, an evaluation was determined, then they would get that evaluation and forward it to you to let you know, and attach the level 1. So you'd have that in your documentation that a level 1 was completed and the level 2 was attached.
Thank you, Joni. Jill, you have your hand up. Would you like to go ahead?
You guys are actually speaking to that question. I was just wondering, as a skilled nursing facility, I imagine they would have to have us either upload or print out the form completed so that they at least know it started. And then if a person did go to a level 2, my question is, does the patient, I think you're trying to speak to this earlier too, does the patient have to be hospitalized until you guys approve?
No, because they could be, yeah, no, they don't need to be a hospital, but they could be, but someone would need to complete the level 1 prior for them to be going into a skilled nursing facility. So if they were out in the community, then maybe the case manager could go ahead and complete the level 1. And then they would send it to, send it to us to access to review to see whether or not a level 2 is needed prior to going to a skilled nursing facility.
So I think some of these questions are, excellent. I think they're getting away from the use of the portal though, and more around the process of what is a PASRR, what is not a PASRR, what are the PASRR rules and regulations. I don't know if the business can speak to that. Bethany did put in a link into the chat for everybody around what the federal guidelines are. So I would urge everybody in this meeting to go ahead and hit that website and then review that, share that with your staff and organization as well. There's a couple more quick questions that I do want to kind of just bring it back to. Are there any questions on how to use the portal, how to register for the portal? I know we do have a couple takeaways around the child-parent relationship, but otherwise, I think from a portal perspective in our demo today, we've answered most of the questions. So let me go ahead and just get these other ones coming in here. To clarify, if we are just doing the PASRR for a level 1, we move on quickly, yes or no? We are just waiting on the review if it is going to a level 2 for review, correct?
Yes. If the level 1 is needed for a level 2, then yes, you will have to wait for the evaluation. But if it's not going to be, if a level 2 is not needed, then no, you're not waiting. You're going to be sending the level 1 and along with the medical records to the skilled nursing facility.
Okay. So if they know a level 2 isn't needed, keep it moving. If they need a level 2, they have to wait.
Correct.
Okay. If they come in for convalescent care and are expected to stay for more than 30 days, do we submit another level 1 at conclusion of a time limit or status change?
Oops. Yes. If they're going to be in your facility for more than 30 days, then yes, you will need to submit in a new level 1, and it would be the conclusion because it has been past the 30 days.
So on day 31, they would need to start a new PASRR level 1?
Yes. So really start looking between day 25, 26, whether or not you know that they're going to be there longer. Then yes, start to initiate a new level 1.
Okay. So do skilled nursing facilities fill out level 1 PASRRs?
Yes.
I think that just answered the question. So if they're there for more than 30 days, then yes, the skilled nursing facility would need to fill out that level 1 PASRR for another review.
Right. And
Okay.
I think
then,
the reason, I'm sorry. I think the reason they're saying that because sometimes they get a patient that the hospital did not complete a level 1. So once they get the patient and there's no level 1, then yes, you would need to complete a new level 1.
Okay, perfect. Thank you. And then another one is, what is the time frame we have to start using the portal? So we are planning to do 2 more trainings next week for our level 2 consumers. The user guides and these training videos will be posted, I believe, no later than the 7th or 8th of this month. So end of next week. We're working on that. I don't have an exact date just yet. And then coming up in mid-November, we will be launching the portal, and then we'll be expecting our community to be utilizing the new access portal. Does that answer your question, Harry? Okay. There's also a automated response in the mailbox right now so that you will be redirected to the website. Is that correct, Bethany? They'll be redirected to the website so you can get all of the information that we're already sharing with you.
Yes, that is correct.
So I would just urge, I know your organizations are probably larger than who's in attendance today. We understand you can't possibly have all of your staff in one place at one time. We get that. But I would just urge that we just use this, communication chain to share the information you've learned today, share with everybody in your organization the PASRR website, the federal guidelines that were shared, and just start reviewing all of those things as soon as possible. And then keep an eye out, again, like I said, keep an eye on that website, because that is when we will post the banner, the alert to say when the exact go live date will be. But it will be mid-month of November. So in the next couple weeks. So if you navigate to that webpage, Rita, the PASRR access page, it has the training webinars posted there, but the ones for the nursing facilities and hospitals are now complete. So next week they will be for the REBAs, medical directors, and psychiatrists. So it won't be around a level 1 form. It'll be around level 2 processing. So from here forward, you will need to access this webpage, access the user guides, and then we will have this recording. We'll probably, I don't know, take off the Q&A. I'm not sure how we'll edit this, but we will definitely be posting the demo portion of this where Sana was showing the screen, showing how you walk through the literal walkthrough of everything as the demonstration will be posted to the PASRR website as well. So it'll be consumable, you know, to everybody in your organization. Okay, anything else before we wrap it up? I think Q&A questions have been answered. I think we've got everything in chat. Let me know if I missed anything.
I do have one more question.
Yeah.
Yeah, if we don't know the exact date that they had a mental health treatment or rehab, is a rough estimate okay?
Are you talking about what part of the level 1 are you talking about? Like if they were admitted inpatient or?
Right, if they're admitted inpatient, there's a calendar and I think you guys said that's a hard
Yeah,
stop. Like
yeah.
we can't move forward.
Yeah, I would, yeah. It's hard to pinpoint exact date because sometimes the patient doesn't even know either.
Oh,
So
right,
it's hard for you
exactly.
to determine. Yeah.
Okay.
And some of those things, now that you brought up the date thing, just popped into my head, you know, like Sana had demonstrated typing in, a lot of people like to type in that date manually, like 02/04/2024. It doesn't like, the system doesn't like it that way because it's sort of reverse engineered. So just from a user experience, try to get used to using that date picker, you know, the actual calendar drop down and navigating that way, because you'll get an error message if you try to type it in, you know, month, date, and year, because it wants to consume it the other way. So it will give you an error, but I don't want anybody having a bad user experience going in circles. Just understand that you should go to that date picker drop down and use the actual date picker.
Yeah, I second that. The just for like data consistency, it's very picky about the format. It's hard to get it right by typing in, but the date picker is the way to go.
Okay, thanks, Sana. We have another question. Why no option for private insurance in the demographics section? I think that's probably going to go to the business.
Really, it doesn't matter if they have Medicare, if they have Medicaid, if they have private insurance. This is just whether or not they have these diagnoses and they're going to a Medicaid facility. So if they do have a private insurance, you can just indicate self-pay because it's not going to go through their actual insurance for payment.
Okay, perfect. Thank you, Joni. That answered his question. Okay, so I just want to reiterate, so Jill, I had to take away from you around the parent-child relationship and viewing other people's level 1 forms. And then there was the question from Rita Greenwald around the multi-factor authentication smartphone concern, that that is a requirement, but you don't require your employees to use their own smartphones. Is that what I understood?
That is correct.
Okay. Some more in chat. Let's check the chat one more time. Okay, looks like we got everything. Okay,
Can I
anything-
just confirm? Oh, I'm so sorry to interrupt.
No, go
So
ahead.
Jill's question about multiple people in an organization being able to see all the PASRRs. Can I confirm that will be addressed before this goes live? Because I don't think we're going to be able to operationalize the system at our hospital unless that's live.
We will address it and we will assess it and get that answer, and then we can make a communication. The way that we've been communicating currently is by the associations, because we obviously can't know who's all in all the organizations. But I should have your emails specifically that I can email you to, but we will also send these answers through the associations. And then we're asking that the associations trickle that down, and also have the coordinators at each facility that I can email as well with these answers.
Thank you so much.
You're welcome. Give a short pause for any other thoughts or concerns or questions before we end our session. I do really want to thank everybody for taking the time out of their busy schedules to join us today and learn what we've been working on. And we look forward to launching this and having it be a positive experience. I want to thank everybody for attending.